before I got pregnant, I was always adamant that I was going to breastfeed. I ended up getting pregnant during the COVID pandemic. So a lot was taken out of my control. I had to tell my parents and everyone I knew that I was pregnant over Zoom, not how I wanted to do it. No one was able to come and rub my belly. I had to do NCT classes over Zoom. All of that expectation of what pregnancy would be like was taken away. Then at the very end, at the 36-week scan, Rupert was presenting as breech, surprise, surprise. So I was recommended that I had a C-section. And that took the control out of the birth plan. So as far as I saw it, breastfeeding was the one thing that I still had control over, and it sort of strengthened my resolve to do it. And I prepared. I thought I prepared. I read all of the books. There's this amazing book called The Positive Breastfeeding Book by Amy Brown. I really recommend it. I attended courses. The local maternity hospital at the JR ran these Facebook lives every week with a question and answer session. And I could tell you off the top of my head how to hand express colostrum, what everything was, how you did it. I'd practice on the dolls and that kind of thing. I thought I was really prepared. And I also had some friends who had had not great experiences. And so they very kindly shared where they struggled. So I thought I knew going into it what bits may be hard. Yeah, I didn't know it all. So once Rupert was born, obviously I had the cesarean section. He came out. We were still under it was July of 2021, so we were still under some restrictions in the hospital. So my husband was able to stay with us for just 3 hours after the birth. They brought us into the recovery suite, and a midwife helped to latch Rupert on. And it was honestly the biggest relief I had ever felt, because this one thing had kind of gone the way I envisaged it, if not in the way that I had. And then John had to leave. And unfortunately, because of the restrictions and the timing, John had to leave before I could even feel my legs again. So I couldn't sit upright. I had the cannula in my hand. So I couldn't very easily hold Rupert. I wasn't very mobile. I wasn't really feeling it. And obviously, where I had the epidural and the drugs that they put in you for the cesarean that are medically necessary, they do pass through to the baby. So Rupert was very sleepy, and I really struggled to wake him up. And I want to make it really clear that I fully support the NHS, and it breaks my heart what's happening with the NHS, and we need to support it. But there was not enough support in the hospital for me in that situation. I was left on my own for quite long periods of time, and I didn't know what I was doing. And that was really, really tough for the first night. The next day, the consultant came round, and I was fully expecting to be discharged. But no one had seen Rupert feed. So throughout the night, I had been checked on hourly, and they said, has he latched yet? No, he hasn't latched. He won't wake up. I was having to put wet flannels on him, take all his clothes off to try and wake him up. It was taking maybe an hour to wake him, and then he wasn't really feeding. So they encouraged me to hand express, which I knew how to do because of the videos. But again, not really the resource to support me in the ward. So I had been giving him the syringes of colostrum throughout the night, but no one had seen him feed. So it was recommended that I stayed in the hospital for another 24 hours for observation. Again, because of just the understaffing, through no fault of the individual staff themselves, no one came round to support me. No one mentioned breastfeeding. I raised it with someone who came to stats check on me, and they said, oh yeah, just ring the buzzer when he's latched and I'll come and check it. And by the time I had managed to get him latched, I rang the buzzer. Maybe 15 minutes later they came, and he had fallen asleep and fallen off again. And that was kind of the extent of the breastfeeding help that I got as an immediate inpatient post delivery. So we took him home, and everyone says use your instinct, but when you're a brand new mum who's just had major abdominal surgery, like, there is no instinct. My baby wasn't waking up, he wasn't feeding, so I started pumping because he couldn't latch onto the breast. So I started pumping milk, and we didn't have any bottles because we hadn't planned to bottle feed. So I just remember distinctly, like, putting it in. I read in this book, actually, you can feed via a teaspoon, and we were just putting the tiniest amount of milk in a teaspoon, and he was lapping it up, and it makes me really sad to think of that image. But we were doing whatever we could, got it in. We sort of struggled on, had the midwife checks. Nothing was really flagged other than his jaundice levels. And they were quite high, and they were climbing. And that is a significant risk for newborn babies. So we did what we could. The midwives came to check every day, but by day 4, Rupert was admitted into hospital to go under the phototherapy lights. And again, 4 days post-surgery, but still in the kind of COVID restrictions, I had to go back in with him on my own. And that was probably the hardest time. It was, I mean, to lighten it up a bit, it was my husband's birthday, and we had got it was the day of the World Cup final, and we'd got like a buffet of snacks. And we got the phone call like, oh, Rupert needs to go into hospital, but it's quite serious, you need to go as quickly as you can. And we went into this panic mode. And we've got an electric car, and this is kind of relevant to the story, but we only had enough charge to get to the hospital once. So we got into panic mode. I said, right, I've never packed for a baby. What do we pack? Blah, blah, blah. I'm probably going to be in there with him. So I packed up John packed me a little packed lunch with like a sandwich and some olives from the buffet. Packed some baby grows and nappies and everything. Got to the hospital, and we walked in, and we'd forgotten his little red book, but I brought this like really strongly smelling like salami sandwich. So to the woman that walked in, we had prioritized like my lunch over the red book. And then John had to go back and get it, but he had to charge the car in between. So he was like another hour and a half before we could even kind of, and looking back on it, I can laugh, but I felt like the worst mum in the world at the time. Rupert had the phototherapy treatment, and luckily his levels came back down to a safe level. It was not a great time in hospital. I had to pump. They kind of handed me a pump and left me to it. So I managed to produce enough milk to get my milk supply up during that time. But it was at that point where I started just giving bottles because I could measure how much he was having. He also seemed to find it easier to drink from a bottle. So, in terms of him being really tired, it was easier. And then again, after I think 2 nights under the lights, or maybe 1 day under the lights, we were discharged again, finally home. And I remember the midwife saying, just keep that. I said, well, what do I still want to breastfeed? And the midwife said, well, just keep putting him to the breast. And every time I did it in front of someone who knew what they were doing, he latched and it was fine. And every time we went home and we were on our own and I didn't have all the cushions, the special cushions to prop me up and everything, it didn't work. And in the middle of the night, when you're exhausted as well and your baby, it's taken you an hour to wake the baby up, you just default to what's easiest. So I was still really adamant that I wanted to give breast milk. So I started pumping consistently. Again, we could just measure what was going in him a lot easier, a lot more easily. And that was really hard. pumping exclusively. I admire anyone who manages it for a long period of time, because I felt physically exhausted. I had to kind of weigh too much information, but where you have to squeeze the breasts at the same time. I got repetitive strain injury on my thumbs. So I was in agony, I was exhausted, I felt like a dairy cow. And I wasn't getting any of the kind of hormone hit of actually nursing the baby and having him close to me, because we had to do it in shifts. So I was pumping, John was feeding in a bottle. So I was really keen to move away from pumping exclusively as soon as possible. And I knew that it was still really important to me, but it was touch and go. About 2 weeks in, I thought, is this worth it? Is he getting anything that he wouldn't be getting from formula? It's making me miserable. And that was around the time when people started telling me it was okay if I gave up. And it was really tricky, because that was the one thing that I was really adamant that I wanted. And, there's no shame in giving a bottle, there's no shame in giving formula, but, and this book actually, it covers it quite well. And they say, if your friend told you that they were training for a marathon and they found it exhausting, you wouldn't just say, oh, just give up. You would acknowledge that it was important to them. And similarly, if they didn't want to run the marathon, or they wanted to do it in a different way, you would support them. But that lack of support in my choice, I found really hard. And not having anyone I knew who had kind of passed that point successfully at that point, I felt quite alone in it. Shortly after that, we found out that Rupert actually had breastmilk jaundice. So it was the breast milk itself that was causing these blood cell counts to be high in his blood and his liver. Again, you start questioning, well, if the breast milk is causing this issue, would it just be easier if I gave formula? And so I started feeling the guilt. And on top of that, we were assessed about 6 weeks in, because he still wasn't able to latch. He was starting to wake up a little bit, but he still wasn't latching very easily. When we found out he had a tongue tie, so he had all of this tension in his little body related to this tongue tie. Again, no shame on the NHS. I really support the NHS, but the waiting list, once we got referred, the waiting list was going to be, I think, at a minimum of 3 weeks. She said it could be longer. You can't wait that long if your baby's not eating. That's insurmountable. So we were fortunate enough to be able to pay for it privately. But at this point, Rupert was like 8 weeks old and still really struggling. And he had become accustomed to bottles, and they say that with a tongue tie, the earlier you catch it, the more likely they are to be able to then learn the latch. But because he had been drinking from bottles for a good 2 months, it was really difficult then to get him to latch. So long-winded story short, up until we stopped breastfeeding very suddenly about a week ago at 21 months, Rupert was feeding using nipple shields. It was the only way he would latch. I tried, again, kind of on my own, very ad hoc, because there are far bigger priorities when you're exhausted, but I tried several times to wean him off them, and he would just scream and scream and scream. So yeah, I carried these stupid silicone things that turned out to be our saviors, but I absolutely resented them more than anything. We carried them around for nearly 2 years. There were 2 elements that impacted my mental health around having a baby and the breastfeeding. I think the thing I found hardest about it, aside from just generally giving birth, being pregnant in a pandemic when everyone else is trying to survive as well, the hardest part was the loneliness, because I think this impacts people on both sides, or every part of the spectrum. Because if you're breastfeeding and you know people who have tried to breastfeed and couldn't for whatever reason, medically, emotionally, financially, whatever, there are so many reasons why people don't continue. You then really struggle to talk about your experience because you've got it, you've figured it out. If you're doing breastfeeding, what's the problem? But it's really hard. Even if it's successful, it is a constant physical drain. And for me, like I say, I didn't know anyone at that point who had been through even a remotely similar experience. I had several friends who had either started, were exclusively pumping, and they were happy with that. They had different financial support networks, family close by, that kind of thing. And I really struggled to talk about it because I was proud when it went well. I was really proud that I got through it. But then I knew my friends were really struggling because they had tried and they hadn't been able to continue. So I couldn't talk to them about it. And all of the baby groups were still quite closed off. You had to sit back at the beginning, at least you had to sit back with your masks on. It doesn't really invite deep conversation. I was lucky enough to have one NCT friend in particular who we are still very close to this day, and she was a brilliant support. But even she, because she had an easier time to start with, she felt uncomfortable talking about it to me because she knew that I had gone through the issues with the jaundice and everything. So no matter what stage you're at, it's very difficult to find someone who you're comfortable enough to talk to. I think my mental health was impacted the most by the loneliness, and that was definitely exacerbated by the pandemic. But it was also impacted by that lack of accommodation for new parents, like for the world in general. Even in the case of breastfeeding, everything is made so divisive. You either are a breastfeeder or you're not, and you can't talk to each other about it because it's made out to be either or. And it's so very rarely binary. Even in my journey, it was kind of wavering between the two. So I really struggled I didn't feel like I had permission to talk about what was going well or to talk about the fact that I was proud of it, because there's always someone who's having a worse, harder time, or someone who is feeling like they failed because they're not able to do it. But you need that validation as well. My journey wasn't easy, but it is something that I'm still proud of. Yeah, that was hard. The advice I would give to anyone who is expecting a baby, and either planning to breastfeed or not, is to think really carefully before you give birth about what's important to you. Think about the support network that you have. Think about, is this something that you want to try, knowing that it's, for some people it is just like, a light going off, but for a lot of people, you will have to fight to get it to work, fight to get the help, fight to get resources. And there are amazing community organizations out there, healthcare organizations, charities. Seek out that support. Don't just kind of think, I'll figure it out when the baby comes, because your brain just won't be receptive to anything once the baby's there. Really plan out that support network in advance. I know if I were to do it again, I would think much more carefully about the support that I had following the birth. A lot of the focus is on kind of pregnancy and prenatal, antenatal. And I was saying to a friend, the antenatal course that we did on Zoom, the session that was on feeding was just such a kind of, here's how you tell if a baby's hungry, here's how it will latch, as though all babies just, that's how they do it. Know that it will be really unique to you, but arm yourself with as many resources as you can, even if it is a Facebook group or a YouTube channel, or I think there's an app now that helps with the latch. Push for the support with your health visitors and GPs and that kind of thing, because they do want to help. They're stretched, but they do care. And go easy on yourself and accept that it may not look the way you expect it to, but that doesn't mean it's a failure. I think it's really important that no matter how alone you might feel, and everyone, I would put money on it, every new parent feels at some point like they're the only person in the world going through that particular struggle, but just know that there are hundreds, if not thousands, of people going through that same thing, and there's no shame in it. If you need help, you need help, and we weren't designed to do this alone. So reach out to someone and get the help that you deserve.